Hey everybody, I'm Dr. Morris. I am here to talk about the respiratory system for our Maddie's presentations. We're going to go through some of these slides, and we have, of course we're talking about cats and dogs, and they have many upper respiratory infections, one of the most common medical concerns in shelters, and can be easily prevented with proper housing and management. So hopefully we'll cover some of those today. In both cats and dogs, they are usually caused by a primary viral infection that damages the respiratory epithelium and the mucociliary apparatus that allows for a secondary bacterial infection to thrive. Most respiratory infections in shelters involve more than one pathogen, and they can progress to pneumonia if left untreated. So we're going to talk about many different factors that play a role in determining the risk of infection. We have some host factors that we're going to start with. So we have the age of the animal. Puppies and kittens are more susceptible due to a lower immune system, and they also have a lack of protective antibodies since the mother's milk kind of interferes with that. And they also have an ineffective response to vaccines when they're so young. The ASV, which is Association of Shelter Veterinarians, recommends separation of puppies and kittens if they are under 20 weeks of age. So about 5 months old, you should keep them separate from adults. Again, with lack of immune status, unvaccinated adults are also susceptible. So stray cats and dogs, we don't know their history. They come in and they're usually not vaccinated, so they don't have any vaccine history. Their immune system is susceptible to anything. So the Association of Shelter Veterinarians, again recommends vaccination on intake with core vaccines, which include the most common upper respiratory pathogens that we'll talk about. So we have the feline and the canine vaccines that we usually give on intake, and also the Bordetella vaccine, which is an additional one that you can give to dogs. They recommend a modified live virus, which we'll talk about later, and they also recommend vaccinating pregnant and nursing animals as well, since they're highly susceptible to disease. Debilitation, so if they have a current illness when they come in, they can also be susceptible to getting an upper respiratory infection. And then the big thing is stress. So dogs and cats, it's a very stressful situation to be here, so their immune system's lower and they can get any one of these diseases. All right, and then we're going to go on to the pathogen factors. Before we talk about the factors, we need to talk about the different pathogens that we're concerned with. So we have canine infectious respiratory disease, which is a complex that we call kennel cough. So it's not usually just one pathogen. It's a complex of many different pathogens, both viral and bacterial. So the common viral ones are parainfluenza virus and respiratory coronavirus. And then the bacterial ones that come up are Bordetella and Mycoplasma cyanose. So those are the ones we have to worry about, and we do have vaccines for most of those. And then in cats, 80 to 90% of the upper respiratory infections we'll see in cats come from a virus of herpes virus or calicivirus virus. And then once those are in the system and damage the epithelium and everything, then the bacterial infections can proliferate and grow. All right, so clinical signs that we see are dogs. We often see them coughing. We'll see sneezing. We'll see some nasal and ocular discharge. Cats, we often don't see coughing. We can see it with Bordetella infections. We usually see the nasal discharge, ocular discharge, and sneezing with cats. Feline upper respiratory complex can show up in many different forms. These are some pictures of little tiny kittens that come in with herpes or calicivirus with secondary bacterial infections. Their eyes are shut. They have got conjunctivitis. They have discharge coming out of their eyes. They're not really feeling well. I have a picture in here of a spoon feeding this little kitten because they don't like to eat because they can't smell anything. They're so congested. They have a bunch of snot in their nose, so we have to make sure that they're eating. Oftentimes, if you just put some food in their mouth so that they can taste it, then they'll realize that, oh, I can eat this, and then they'll continue to eat on their own. So just keep an eye out for these little tiny ones that aren't eating because they can't smell very well. We see many different changes in the eyes. So herpes virus will damage the cornea, which is the front part of the eye, the clear part of the eye. And their bodies, the kittens' bodies and cats' bodies, will try to heal themselves by forming adhesions. So they'll take their inside of their eyelid or their white part of their eye, which is their sclera, and attach to the defect in the cornea. And it'll kind of grow over that area like a Band-Aid. Of course, it's a great thing that they're doing, but it can cause damage to their development. If they have their eyelids are shut permanently, then their eye underneath can't develop properly, or it can get infected like this kitten on your right that you see here. So on the left, you can see a little bit of an adhesion on the top corner of her right eye. Sometimes they'll do fine and they can live like that. Other times we have to have our ophthalmologist go in and surgically cut the adhesion just to allow the eye to grow properly. They do recommend to wait until they're about 6 months of age to do that so the adhesion doesn't regrow, which is always possible since their bodies like to heal pretty well. All right, and this is just a fun picture of my kitty. This is my cat named Winky. I know it's a little bit of a sad name for him, but he had to have his eye removed because it was severely infected and not getting any better with our antibiotics and treatment. So kennel cough complex, which is what we normally say in dogs, doesn't affect the cornea as much, but you can see some conjunctivitis, which is the clear discharge coming from the eyes. You can see some nasal discharge. Sometimes you can see swelling, which is the one on the right, has severe swelling of the eyelids. We worry about some of these viral infections with them. And of course, again, they can both progress to colonize the lower respiratory tract and cause pneumonia. So we don't want to let it get that far. We want to treat them sooner than later. Of course, there are other reasons for coughing in a dog and cat. There are other reasons for sneezing, so we have to talk about those. So if you're in an area where there's heartworm disease, you have to worry about that because dogs will cough continuously. They will cough through your treatment for upper respiratory infections. And then congestive heart failure, you have to put that on your list. It could not be kennel cough. It could be congestive heart failure. So have your veterinarians listen to them, make sure they don't have a heart murmur. Little dogs get what they call collapsing trachea. So as they get older, their cartilage around their trachea is not strong enough, and that will kind of fall in on itself and cause them to cough. We can help that by putting a harness on them, and that might help the coughing. Of course, if there's a foreign body in the trachea, they will cough that. They'll cough with that, and then feline asthma can be seen as coughing too. So don't always jump to an upper respiratory infection, so a viral infection or a bacterial infection. There's other things that you need to rule out and think about as well. Other causes for ocular discharge. There are many causes for ocular discharge. In kittens, we see eyelid agenesis, and that is when the eyelids don't form all the way across, so they don't have that barrier between their eyes and their hair around their eyes, so that hair gets into the eye and causes irritation on that cornea and causes the eye to build up discharge and be damaged. Corneal ulcer can be caused by anything, so if the dog got poked in the eye, if you see some of the pugs with the very, very big eyes, they can have damage to their corneas just because they can't close their eyes all the way. You can have corneal ulcers, you can have dry eye, which is an autoimmune disease where the body is attacking its tear-producing cells and is not able to produce tears anymore, and that consequently causes a dry eye, but we see ocular discharge with that. Kind of counterintuitive, but that's just what we see. We see kind of what this dog has, like a thick, purulent discharge. It's just a buildup of the other things that aren't supposed to be there because they don't have any tears, if that makes sense. And there's other reasons for it, so make sure your veterinarian does a thorough eye exam on some of these. They can have entropion, which I didn't mention here, and that's when the lower eyelid in like Shar-Peis that you see or some of the brachycephalic dogs, the eyelids will roll inwards, and then the hair around their eye will get into the cornea and cause damage to the cornea. So you have to rule out those other causes of ocular discharge too. Oral ulcers is a big thing to talk about with cats because sometimes we'll see an oral ulcer and get really, really worried that it's calicivirus because that's what we've learned is oral ulcers equal calicivirus. But these are three pictures of different diseases, one of which is calicivirus. Of course, you can't tell the difference. You might suspect that one is worse than the other, but again, you don't want to jump the gun and say that everybody with an oral ulcer has calici. So these pictures, picture A is feline calicivirus. It was diagnosed. Picture B is a kitty that licked some bleach, some quaternary ammonia complex. So they had toxicity and ulcers from that, from anything that they lick that's poisonous. And then picture C is actually feline herpes virus. So caleci is what we worry about because it's very scary in shelters that can mutate and it can cause a virulent strand of caleci that we can't get rid of, and it's highly contagious. So we do worry about it. So you have to talk to your shelter manager, your veterinarian, to see if it's feasible to test any cat with a oral ulcer, if it's feasible to quarantine them, isolate them. It is basically up to the shelter in the situation that you're in. So sometimes we have to euthanize if we see an oral ulcer, if we feel like we cannot test for it, rule out these other causes. So it's basically up to the management and everything. So, but don't jump to it. There's some other reasons why they can have ulcers. Just discuss and talk about the protocols that you have. All right, so what are some other signs that you may see if you're dealing with caleci virus? You guys think of any? You can just think in your heads because this isn't a live presentation. We can see acute arthritis, so limping kitten syndrome if you have a cat that has some shifting limping, so one leg's limping one day and the other leg's limping the other day, and it has some concurrent, ocular things going on, some sneezing. You might want to think about caleci virus and just, warn the foster family that has them, warn the staff that has them. Hopefully you have proper protective equipment that you can use when dealing with these little kittens. So that's just something to keep a lookout for. Vasculitis is when the cells around the blood vessels are damaged or inflamed, and that allows fluid to come out from the blood into the area, into the skin and everything, so that causes edema, and that can also cause damage to the hair, which will result in hair loss and ulceration of the skin. So if you see random skin lesions on these kittens, you see limping, and you see the ocular and the nasal discharge and the sneezing. You may not even see the ocular and the respiratory things. You might just see these random ulcers and skin lesions and limping, and you have to keep caleci on your radar. These are some pictures, not really easy to see, but you can see the one cat on the top has some skin lesions around, I think that's his belly, and on the bottom you can see that the right leg of that white kitty is a little bit swollen, so edematous, so there's fluid that is able to release from the blood vessels due to vasculitis, causing that swelling. And of course you can see that he has horrible ulcers around his nose and possibly some nasal discharge as well. All right, we're going to continue to some of the factors, pathogen factors that show that there's a risk of infection. So we have virulence. Does anyone know what virulence means? We can kind of think about that. That is the extremely severe or harmful. If it has a high virulence, it means it's extremely severe or harmful in its effects. So we talked about the mutated viral strands of caleci virus we have to worry about. Canine distemper is one we definitely have to worry about. They can be infected younger and then develop, if they have it when they're younger, they can develop neurologic symptoms when they're older. Strep zoo epidemicus is another one that shelters are seeing, and that causes sudden death in dogs. And also concurrent infections can cause just a normal upper respiratory infection to be virulent. All right, incubation period is very, very important. This is the period between exposure to a pathogen and the appearance of the first signs. So why does this matter? It matters in determining how long the animal should remain in quarantine to determine if they have become infected. So we'll go over that a little bit further later. And then the shedding period is a time in which the virus is expelled from the body. So it often means when the virus is contagious and determines how long they have to stay in isolation. So let's talk about, these are great charts. We can provide you with a copy of these when you come here. These are some very important things to know. So we have the common canine viruses and canine bacteria, and the common feline pathogens as well on this chart. So except for, if you can look at this, except for canine distemper virus, which is CDV, the incubation period is only 1 to 2 weeks. Okay, so everybody else, even the feline ones, incubation period is less than a week. So that means that's how long that the animal has to stay in quarantine. So if you have an exposed animal that comes down with an upper respiratory infection showing signs, then everybody else in that pod or kennel area has to be kept in there for about a week to see if they're going to show signs. So that's the incubation period of that disease. Now the shedding period is how long that infected animal is going to shed the virus or the bacteria, and that's usually about 10 days, about 1 to 2 weeks. So that is how long the animal will have to stay in isolation. All right, so that makes these diseases easily to treat or manage in shelters because the incubation period is only about a week. So that correlates with the amount of time you have to keep them in quarantine. This is a short amount of time. Usually makes quarantine feasible for shelters. Now, you do have to worry about canine distemper virus, which usually takes 1 to 4 weeks after exposure to show signs, typically 1 to 2 weeks, and usually only if you have canine distemper virus in your community, you will talk to your veterinarian and see if you need to just quarantine all upper respiratory dogs for about 2 weeks, just to make sure that you don't have canine distemper virus. So that might be a good thing that you can do. And then again, most shedding periods for dogs are less than 10 days, so you don't have to keep dogs in isolation for more than 10 days. So the thought is that they'll stop shedding the virus or the bacteria in about 10 days. So you can safely put them out in the community and they will not be contagious after about 10 days for most of the viruses. The bacteria are a little bit different. You can see that Bordetella can be contagious for longer, so just discuss with your adopters and just discuss the risks, and they should be okay talking to their veterinarian and making sure that it's safe to bring the dog or cat into their environment. All right, let's go back and talk about the cats. I think we didn't talk about that. So again, the incubation period for cats is less than a week, so you have to keep them in quarantine for a week to see if they're going to show signs. The shedding for cats are a little different. It can be 2 weeks to 3 months depending on the pathogen. So these are a little bit difficult to keep them in the shelter for that long, so hopefully you'll have a good foster base or a good community that will be okay adopting these cats, knowing that they could still be contagious to their other cats. Of course, feline herpes virus and calicivirus are 2 that we vaccinate for, so their cats at home should be vaccinated and will have a less likely chance of contracting the disease if they do bring one of these cats home with them. But of course, it's not always feasible for some shelters, so you have to discuss what's the best thing for you to do in your situations. Okay, let's go on. Oh, it's going to make me go through all that again, sorry. So canine distemper virus and then canine influenza, which is the H3N2 virus, and feline calicivirus, and all the bacterial pathogens, which are Bordetella, Strep epidemicus, Mycoplasma, and Chlamydophila, and they have longer shedding periods. So adoption waivers need to be written for these, like we talked about. Make sure that you have a community that's okay adopting these animals into their home with the risk that they could have a contagious disease that they could contract to their animals at home. And also encourage them to see their veterinarian as soon as possible, just to discuss further treatment and care and preventing the disease in their animals at home. All right, so we talked a bunch of terms. So what's the difference between isolation and quarantine? So if you think, we have an example of a room, so we have 10 dogs in that room, and one dog starts sneezing and has some nasal discharge. So the idea is to, so if you have that sick animal that's sneezing, you have to isolate him. So you remove him from that room and put him in an isolation ward if you have one. Hopefully you do, or send him out to foster, or I guess foster, or you can make other decisions on what to do. And you isolate them for the amount of time that they are shedding. So that's why that chart is very important, to know the timelines for each of those, so you know how long these animals have to stay in isolation and stay or will be contagious. So the other animals, those other 9 animals dogs that are left in that room, you should keep them isolated, so don't bring any other animals into that room, don't take any of them out. You have to quarantine them, so you have to keep them quarantined. So those are different terms. Isolate means whatever, but if you hear people using these terms, this is what they're talking about. So they're quarantining them for the amount of time that each disease's incubation period. So if you're worried about distemper, you have to keep them in there for about 2 weeks, maybe up to 4 weeks, just to see if they're going to come down with signs. Okay? So if one of these exposed animals that are in quarantine for the incubation period starts showing signs like sneezing, nasal discharge, ocular discharge, then we have to start over. So you have to go back to the very beginning and then start over and keep those animals, isolate that dog, and then keep the other animals in quarantine for the incubation period. So you restart the incubation period for those particular animals. All right, I apologize that this is going. All right, we need to talk about subclinical infections, and this is most common in cats. So this means that the virus can start shedding before clinical signs develop, which sucks for us because some of the animals, you don't know if they've been shedding for so long in a certain area with other cats. It could easily cause them to be contagious before we even know about it. So it's really important for us to make sure we keep an eye on all these animals that are in with us, keep an eye on their respiratory status, their nasal discharge, anything that we see sneezing. It's really important to keep that on our radar. Train your staff to keep that on their radar and make sure we're catching those early. So preclinical shedding occurs in all feline respiratory pathogens and most of the canine respiratory pathogens, so they can be contagious before they look sick. So do walkthroughs in your shelters, make sure your medical staff is doing walkthroughs, making sure everybody's eating, all the kittens are eating, taking a look at their nose and their eyes. That's something you can do while you're walking through and just looking at every single animal. It's really, really important. Just to note that Bordetella can cause a chronic infection in untreated dogs, which can cause intermittent relapses in the disease, and then shedding can last up to 3 months. So you do have to worry about Bordetella, so hopefully you have the means to vaccinate for that on intake as well. Okay, going on to another pathogen factor is called a carrier state. So this is also in the feline diseases. Once you're infected with feline herpes virus, you're infected for life. So I don't know if anyone knows that it hangs around in your facial trigeminal ganglia, which is a nerve bundle in your face, and it's reactivated with stress. So all of the cats that come into us are stressed. Even cats in my home, your home, everybody's home, they can be stressed with a little changes. So if you're going to have a cat with a herpes virus, cats will have herpes virus for life. So that's something to note for your adopters as well. Make sure that they know that the cat might start sneezing when it comes home with you because there's a stressful event from moving from the shelter to your home. No big deal. And just tell them to go to their veterinarian to see what the next step should be. All right, so with that, with the cats being carrier states, most of the cats that we get into our shelters have feline herpes virus, and some of them can have feline calicivirus as well. So the important thing from here is do not house adult cats with the kittens. So ASC recommends keeping all animals 20 weeks or younger separated from adults. So same thing goes for kittens too. All right, feline herpes virus can shed for 1 week after the stressful event and can continue shedding for 1 to 3 weeks before showing clinical signs. So we have no idea which animals are going to come in with calicivirus or herpes virus, and they can be shedding it without us even knowing. So it's really important to keep these guys separate from each other. Excuse me. All right, so we're going to talk about how they're spread. So I'm sure everybody knows how these pathogens are spread. This is a cool little animation here. So dogs, so obviously in their aerosolized secretions, so from their nose, from their sputum, so if they're coughing up stuff, it can be contagious. In dogs, it says they can cough and sneeze up to about, I think it says 20 feet or so. So they can go pretty far. So if you have a dog that's 20 feet away from another dog and they're sneezing, you're going to have to worry about the other dog contracting the disease. In cats, it says it only goes about 4 feet. Still seems kind of like a far away, but the recommendations that some people give is that you don't really have to remove cats and kittens as much as you should move dogs into isolation. So cats can do well in the cages and not transmit it to other cats that are around them if you have the proper husbandry techniques and cleaning protocols. The recommendation is that you could just cover the front of the cage so that they cannot get their aerosolized particles into the other cats' areas. So the reason for that is because cats are, they like to be in the same place and they like to be around their same things. So moving them around the shelter is just going to increase their stress even more. With that, they can cause their herpes virus or their calicivirus to get even worse. So if you have the ability, of course, there's protocols that you should be writing and keeping an eye out. So if you have a cat with extreme upper respiratory, nasal discharge coming out, a bunch of purulent nasal discharge, sneezing all the time, coughing, even coughing at that moment, then you would think about isolating them. So these are protocols that you should write, but if you just have a cat or two that are just sneezing, you can, of course, assess them, make sure there's nothing else going on, make sure they don't have a temperature, cover their cage, and they should do fine, rather than moving them and causing more stress. So it's by case basis. If a cat you don't think is going to care to move, then just move it. There's just things that you can think about. You don't always have to move them, but there should be protocols so everybody's on the same page. All right. So just another thing about pathogens. Sometimes we can have an incomplete protection by vaccines. So we don't know, of course, we don't know the animals that are entering in our shelter if they are vaccinated or not. Lots of times they have low protective titers. I know there are studies out there that have tested the animals that have come into them and they don't have titers for these diseases. So vaccinations on intake are always good. Just to note that vaccines aren't always 100%. They just lessen the disease. So I'm sure you've heard some people with a flu vaccine might not be the same strain of flu, but their disease is just lessened. So they might not get the flu as bad as they would have before, but they still might get the flu. And of course, there's no vaccines for new pathogens. So the virulent calicivirus that we've been talking about, there aren't any vaccines for that yet. So we have to worry about that. And of course, vaccines mutate or viruses mutate just like the human flu does as well. So they're not always 100%. All right. Oh, what is this a picture of? I think this is a picture of the virulent calicivirus just to show you how bad it can be. It can cause ulcers around I think there's ulcers on the tongue there, along with around the gingiva. So this is a case that you would be really worried about. Something else going on that could be contagious. So you discuss with your veterinarian and your upper management on what to do in that case. All right. So husbandry factors. Stress is a huge situation that can cause these respiratory diseases to proliferate and grow rampant. So the best things you can do is provide enrichment for your dogs and cats, keeping them in the same place, lowering the stress. Follow the ASV guidelines, keep the cats and the dogs in the appropriate size cages, keep them separate from each other, make sure that they can't hear each other, make sure they can't hear loud noises, make sure your staff's not playing loud music. Lots of things that you can do in your shelter to prevent stress. Just think if you were in the same situation, what kind of things would stress you out? So we talked about some of them. Crowding, so if you have too many animals in an area, if you don't have the correct cage sizes for them, and then random commingling means that if you have a dog that came in 2 days ago, you put it in a dog that just came in, you don't know the history of those two, so you should not put them together. So that can increase your upper respiratory infections in your shelters if you have to commingle them. Sanitation, of course, so you have to make sure you follow the correct cleaning protocols. I believe Dr. Bice is going to go over a whole thing about sanitation with you. And then ventilation, of course, make sure you have a good ventilation system. Ideally, you could keep dogs in an outside or indoor run if you're in a good environment for it. So that's always an option, or just have good ventilation system in your whole building. chronic moisture, so if you don't keep the cages dry, it can help these diseases proliferate along with other diseases too. All right, so what's the best cleaner to use against upper respiratory viral pathogens? Give you a second. Hopefully you've watched Dr. Bice's disinfectant lecture. So we say it's trifectant or Excel. You can use bleach. It'll inactivate the virus, but you have to remove all organic debris first when you're using bleach. So trifectant and Excel, you do not have to do that. So it's a little bit easier and less time consuming for that. Okay, and we talked about that. So untrained staff, as you guys all know, if you don't have the staff trained, I'm sure you get some diseases that might proliferate in your shelter. If they don't understand the disease, they might not understand that lowering the stress level or cleaning the cages or removing the moisture or keeping them stress-free, washing their hands, using proper protective equipment. They might not understand the disease, so they might help in the transmission of it. So, of course, washing your hands, wear proper protective equipment. So if you have an isolation area, make sure that everybody's wearing a gown, footies. Ideally, the gown would go all the way down to the floor, and gloves just when they're in there, so they don't bring anything from that area into the shelter, into the healthy animals. Improper vaccination strategies. So hopefully, I know money is sometimes an issue, but the Association of Shelter Veterinarians recommends that you vaccinate on intake. I think I have a slide on that. Yep. So, of course, they're customized for each facility and developed by your local veterinarians. Puppies and kittens should be revaccinated at 2 to 3 week intervals for their duration of their stay until they're about 18 to 20 weeks old. So hopefully they're not staying for that long, but keep them up to date on their vaccines. And vaccination of all dogs on intake is a cornerstone for prevention of transmission of several respiratory pathogens. So we talked about Bordetella, we talked about parainfluenza virus, adenovirus, and the canine distemper virus, which are all things that we can prevent with vaccines. So we vaccinate here. We vaccinate when they turn 4 weeks of age, and then we vaccinate every 2 weeks after that. We use a modified live virus rather than the killed viruses because it quickly stimulates the immune system. It doesn't have any adjuvants in it, and then it'll increase their immunity to the diseases probably about 4 days in. So you would say that they're likely to be vaccinated and have an immune response 4 days after they arrive. So it's really good to use modified live vaccines for both dogs and cats. Okay, some of the uncommon clinical signs that we can see. So this is an example of canine distemper virus. So you will see changes in their keratin. So along the nose, you'll see some thickening of the nasal planum. And then you'll also see thickening of their hard pads. So the pads underneath their paws can be thickened and cracked. You see that, and you also have history of upper respiratory infection. We could worry about canine distemper virus. And this is the same dog from the previous picture at the bottom right, had some swelling of the eyes and some conjunctival swelling. We were worried about canine distemper with him because he didn't show signs until about 2 weeks later from being here, and he had severe upper respiratory infection. I think it came back negative, which goes to show you that you never know, but it's good to test if you have that ability. And a scary one, Streptococcus zoo epidemicus, is becoming more common in shelters. It's really hard to prevent because they say in 24 hours the dog, after even showing signs, they will often find them deceased with bloody discharge from their nose. So it's a pretty scary disease. I don't think we know much about it yet. It can start with just a cough and nasal discharge and then progress to bleeding in the respiratory system, and then quickly they die after that. So it's not to scare you, but to kind of to scare you, just to keep your eyes out on these animals, make sure that they're staying healthy, make sure you have the great husbandry techniques, your stress level's low, you're not commingling animals that you don't know where they came from. So just just keep an eye out for upper respiratory infections. So I went through that pretty quickly, but here is just a little workbook activity that we had some people do. Just some questions for you to think about while you're going through this lecture, while you're coming through here, while you're looking at other shelters. Think about every single one of these diseases. Think about if you can treat them. So are you able to treat them, physically with your staff, realistically with your adopters? Are you comfortable with adopting these animals out into your community? Or is your management comfortable with it? Like, it's possible you can do it, but it requires education on your adoption staff's part and then relaying that education onto the adopters. So, and also money, of course. Money is always an issue, so if you can treat them, so you have to isolate these animals for, we say about a week, and then you have to keep or about 2 to 3 weeks for the shedding period, and then you have to isolate the other ones. So you do kind of increase the length of stay in your shelter if you're going to decide to treat these animals and to keep the other ones in quarantine until they show signs. So it's a discussion to have, and most people are able to do it. So, so will you be able to isolate animals showing upper respiratory signs? Will you be able to quarantine those exposed and not bring any animals into that space? If you have 2 dogs in an area and one dog starts coughing, you have to keep that other dog quarantined, and you have to, you basically have to keep that space clear of the other animals. So sometimes it's not feasible to have 10 empty cages, 10 or 9, 9 or 10 empty cages when you have such a high intake of animals. And to be honest, we don't really quarantine. We just kind of keep them on our radar and just continue to watch. We do walkthroughs every day in the morning, so we know when a dog was moved out of an area. We know to watch the other animals for any of these signs that we're seeing. So it's possible. We can talk about, you have to make sure you have all the other things on board. So low stress, proper enrichment, proper cleaning. If you have all of that in place, it should be okay to treat these animals. Again, do you have the proper personal protective equipment and cleaning supplies in order to treat your facility for these diseases? And just some brief things about stress. So after watching this lecture, if you think about 3 to 5 things that you can do immediately to reduce stress. So not moving cats, spot cleaning the cat cages, keeping them with the same bedding if it's not soiled, certain things you can do to reduce stress immediately without, causing a lot of training on your staff or asking for a lot of money. And then 3 to 5 things that you can think about to improve the stress in your shelter in 3 months. So start planning it. So maybe you can ask for correnda beds for everybody so they have a nice bed to sit on. That might be feasible for 3 months. It might be feasible to do in a year. So just to brainstorm, think about if you can even feasibly treat these animals and to reduce the stress in your shelter. All right, I think that is it for me, and I will see you in another lecture. Thanks.